Bom dia a todas e todos. É
Good
com grande
morning,
satisfação
everyone.
que a Escola
It is
Politécnica
with a
de
great
Venâncio,
satisfaction that the
com
Polytechnic School Joaquim Venâncio from Fiocruz,
20 anos como centro
who is
colaborador
currently
da
becoming
OMS para a
20
aplicação
years
de
old
técnicas
as a
de
collaborator in the
sociedade
sector for
científica
the
nesse
World
ciclo
Health Organization,
sobre a
we're
participação dos
starting our
técnicos em
webinar
saúde
cycle
no campus virtual
with the
da
participation of
organização
technicians
mundial.
of health in the field
Desde
of
dezembro
health
de
in general.
2023, em um
Since
acordo
December 2023,
internacional
in an
entre a
international
OMS,
cooperation action that was
OPAS
developed
Brasil,
by the
OPAS
Polytechnical
Brasil
School
e o Campus Virtual de Saúde
together
Pública,
with OPAS Brazil and the virtual
a
field of health,
expansão da participação dos técnicos em saúde no Campus Virtual
the
da Saúde
research
Pública tem
and
buscado
increase
analisar
in
as
health areas has sought to
desenvolver
analyze the
técnicas
trajectory and
e
experience of all technicians who have been part and who have taken courses in the area of virtual health.
organizaria três eventos
The
virtuais
project
para
foresees
compartilhar
three
os
virtual
resultados
events
parciais dessa
so we can
investigação.
share partial results
Nessa
of this
primeira sessão,
investigation. In this
abordaremos os
first
caminhos
session,
metodológicos que se
we'll
fizeram
be talking about
necessários ao trabalho com
the
a base
method
de dados do
paths that
Campus
were
Virtual da Saúde
necessary together
Pública
with the
e os
database
primeiros
of the
resultados
public
da
health
análise
database.
do perfil e das
And we'll be talking
trajetórias
about the
dos
first results of the
técnicos
profile
no
analysis
Campus
and the
Virtual da
trajectory
Saúde
of the
Pública.
technicians in the virtual health field.
Das apresentações, a ideia é que façamos um debate
After the
com
presentation, the
convidados
idea is that we carry out a
conosco
debate
nessa
with all
transmissão
the
e
guests that we
também
have
a todos e todas que nos assistem.
and with
Sejam muito
everyone
bem-vindos.
who is watching
Nesse
us.
primeiro momento, vamos montar uma mesa de
In this
abertura
first moment, we'll
composta
create
pela doutora
an
Ana Maria
opening
André
panel
Corpo, diretora da
created
Escola
by
Politécnica de Saúde
Dr. Ana Maria André
Venâncio,
Corbel, the director of Joaquim
doutora
Venâncio
Gisela
School in
Almeida,
Fiocruz,
catedrática
Dr.
da
Gisele
Biologia da
Almeida
OPAS,
from the
OMS,
Human
e
Resource
pela
Unit in
Gabriela
OM and
Listovski,
World Health
do Campus
Organization,
Virtual de
and
Saúde
Dr.
Pública
Gabriel
da OPAS.
Litovsky, the director of the
Então,
Virtual
aproveito
Health
para a gente
field
dar
in OPAS.
essas
And
boas-vindas
now,
à
in this first moment,
doutora
after
Ana
our
Maria
welcome,
André
I would like to invite Dr. Ana Maria
Obrigada,
Corbel.
Batistella. Bom
Thank you
dia
so
a
much,
todas as
Batistella.
pessoas que estão
Good
aqui
morning,
presentes,
everyone
que estão
who's
nos
here.
assistindo.
Good
Quero
morning to
saudar
everyone who's
cordialmente
watching us. I would like
o
first to
professor
welcome
Gabriel
and greet our
Listovski,
friends here,
Gisele
Gabriel
Almeida
Listovsky,
também.
Gisele
Agradecer a
Almeida,
participação de vocês nesse evento e do
and also to
aceitamento
thank
do
everyone for your
convite para
participation and
a
every
gente
one of our guests who
participar
have accepted
então
to be here
desse
in
início
this
desse
discussion,
processo, né? Como
in
se
this
fosse uma
beginning of this
apresentação de
process,
contas inicial do que
like it
o
is a first moment to talk about
desenvolvimento da
what we're
escola
doing
com o
here in
campus
this joint
virtual
process
da
together
Saúde
with the
Pública.
school and the virtual
E aí eu
field,
queria falar
the
brevemente a
virtual
importância
campus.
desse projeto. Como o Batistella falou, a gente é sendo colaborador da Organização Mundial de Saúde, da
It's
OPAS,
like we've
na
mentioned
educação
here,
de
since we are
técnicos. A
coordinators in
gente,
OPAS,
esse ano, completa 20 anos.
this year we
E
have
esse
20,
ano
we've
também a
become
gente
20 years old.
completa 20 anos da reativação da RES, né? Porque quando a
And
gente
we're also
falou no começo da
talking about,
reunião
it's
da
been 20 years since the
reativação
activation of
da
RETS,
instituição do
our
Centro
network.
Colaborador.
Since we're talking about the activation of our
E
network
nesse
as a
momento,
collaborating center. And in this
a
discussion,
importância da gente
we're
trazer à
dealing with the
luz isso
importance
com que a
of
gente
bringing
como
to light
colaboradores
this whole
técnicos,
contingent of
que a
workers that,
gente chama de trabalhadores
what we
técnicos,
call
que é fundamental
technicians
para a gente
who do not
pensar
have
na
higher
eficiência
education,
dos sistemas nacionais de saúde dos
are the
países
ones that we're talking about when we're
desenvolvidos,
considering
porque
the way to
estamos
strengthen the health
trabalhando
system here in the
junto
American
com o nosso
continent.
centro
And in the
colaborador
case
com
of our
os países
school,
que a
as we are
gente
collaborating
atua
center,
com
all
eles.
kinds of countries which we have
E
a
trabalhador
cooperating
técnico,
deal. We
eu estou
understand
falando
that
de todas
the
aquelas
technical
pessoas
worker, and then we're
que
talking
não
about all those
estão
categories that are not higher education, university
desenvolvendo o
level.
maior
They have a
percentual
high
de
contingent.
trabalho dos
They are
sistemas
the higher
nacionais de saúde.
percentage of work
E
from the
desde a
national
criação da RES, em
systems. And since the
1996,
creation of hacks in
a gente tem
1996,
falado da importância da gente
we've been
trazer mais
talking about
visibilidade a
the
quem
importance
são
of bringing more
essas
visibility to those people, to those
pessoas,
categories, to
quem
those
são esses
workers. Who
trabalhadores,
are
como
those
eles
people? Who are
fazem,
those workers?
onde
What do
eles
they
estão,
do?
como
Where
são os
are
trabalhos
they?
que eles têm que
How do
fazer,
they
quais
do
as
what they have to
qualificações
do?
que eles
What
possuem
are
e
the
de que forma
qualifications that they currently
be it
have?
OPAS,
And
OPS,
in
como
what way, be it
técnicos
OPAS,
ligados com a
OPS, and be the
OMS,
Polytechnical
podem
School, and
fortalecer
the
e
collaborators from
qualificar
OMS,
esses
how they
trabalhadores.
can
Então,
actually
atuando
qualify
nisso,
those
essa
workers.
necessidade que tem sido levantada
So in
pela gente
this
durante todos esses tempos de
scope here and this understanding that we need to improve the qualification of these workers, we insert this project in that scope of trying to improve the qualification of those workers. And we understand with that there is a great opportunities for strengthening the qualification of these workers. And that's why we're really happy to be here in this seminar today. Thank you. Thank you very much, Ana Maria. Immediately now giving the floor to Dr. Gisele Almeida from the Unity of Human Resources from the World Health Organization. Good morning, everyone. Gabriel Litovski, Dr. Ana Maria Corbo, Gabriel Batistella. In the name of Benjamin Porter, the head of the Unit of Human Resources for Health for the Pan-American Unit for Health, I first would like to thank everyone for this invitation to be here in this event with all of you. We recognize the importance of the technical worker in these activities of the sector, and we celebrate this joint initiative from the campus and Joaquim Venâncio. This journey of learning and development is a big step in order to give visibility to the workers in health. Because despite their name, we're still diluted in the Americas due to the great differences that we still had considering the attributions of those professionals. From the perspective of our work at OPAS, at the Unit of Human Resources, it is important to understand that we're working with a plural space of inclusion of all the workers of health. And one of our goals is to make these workers, these invisible and peripheral workers, more visible and to improve their working conditions. In this working trajectory with human resources for health, we're facing a situation in our region, in the Americas region, where we still have a lot of inequalities in working conditions and salary conditions. We lack psychosocial support in terms of mental health and welfare of the workers. There is a low attraction and retention of those workers in rural areas, remote areas. We lack systems of information about our workforce in the health area. Either they are incomplete, non-existent, incomplete, or fragmented. So we do not have a lot of information about this type of, especially about this type of professional. So in order to start a process of conscientization and awareness together with all the countries in the areas to solve these issues, in September of last year, the General Council of OPAS has approved a policy about it. And this policy provides guidelines and technical guidelines for the member states in order to improve the human resources regarding health. These joint actions, like this one of today, created by Joaquim Venâncio Campos, they are essential to meet our joint goals. We are available to help you in anything that you need. Congratulations to Joaquim Venâncio for your 20 years of activity and for your work that's of utmost importance. I would like to make myself available once again and give my welcome to everyone who's part of the seminar. Thank you. Thank you very much, Dr. Gisele Almeida. And I'll give the floor to Professor Gabriel Litovski, direct head of the virtual campus. And then we'll begin with our initial presentations about the virtual campus. Welcome, Professor Gabriel. Good morning, everyone. And thank you, Carlos. I was speaking Spanish, so I believe that everyone who's participating in the meeting will be able to choose the language of their preference, be it English or Portuguese, if they rather have it. In the first place, I would like to thank, in the name of the virtual campus, I would like to thank Ana Maria Corbo and all the team of the Polytechnical School of Joaquim Venâncio the opportunity of leading this project that is fundamental for the future of the Pan American Health Organization. I would also like to thank everyone from the World Health Organization and for their social work in this situation, this achievements that we've been bringing so we can define and keep track of all these health workers in this area. The virtual campus already has more than 3 million users, but for us, it is fundamental and of utmost importance that we get to know all of you and get to know where do you work, where do they work, and what are your needs, what are your worries, what are your concerns. And in that sense, this first meeting that deals with this research investigation that's currently happening will be fundamental for everyone here. I would also like to highlight and recognize the Spanish operation with the Spanish Agency for International Cooperation that's with us here today by funding this project. And that for sure will be something that will be a key in all of the meetings that we'll develop together. I would also like to celebrate the Polytechnical School that's celebrating 20 years as a collaborating center. Because together with us in terms of the Human Resources Unit, we're being strengthening this collaborative and cooperative work for this region. And in this point, I would like to highlight the story of the network that we have that must be a key part and discuss what we're going to do and where we're going. So I would like to congratulate you all on this meeting. I would like to thank the whole team. We'll be talking with Dr. Marisa and talking about our institutional work so we can kickstart this project. And now, if you allow me, in the next moment, I would like to take a few minutes to show you my screen. 1 minute, let me share my screen with all of you. Tell me if you can see it clearly. You have to put it in the presentation mode. Thinking about this opportunity that we have in this meeting and this challenge of getting to know our technicians in the virtual campus, let's put some of a reference here for our friends who are watching us on YouTube about the virtual campus of the organization. The virtual campus is intended to develop the capacities and competencies of all the workers of health by supporting the transformation and services and the practices of public health in the region of the Americas. Our challenges here is to deal with that in a way that we may work and think of it as a community. And this can only be done by articulating things inside the health services. The central principles of health are related to the public wellness, permanent education in health, open and interoperable resources, and a strong focus on collaborative management, like we're doing here with these agreements and sustainability that we have as well in our project. So this only happens when we work in articulate in a network way with our institutions and all the academic world as well. So the virtual campus is currently working with all the technical areas of the organization. We're working with approximately 100 courses of self-learning that are open in the 4 official languages of the organization. Our main users are Spanish speakers, but we're growing every day in English for our countries in the Caribbean and French for Haiti, and also working together with Brazil with our courses in Portuguese and articulating the networks in our countries. We have an average of 40 years per class in order to support sub-regional and country works. The activity that we're tracking today, that we're talking about today here, it is a key in order to go further in terms of decision making. It's a type of business intelligence, so information, so we can have better decisions. So making better decisions, making active decisions, so we can improve the whole system. And we're working very proactively in order to improve our international criteria of quality in an associated work with the World Health Organization Academy. Here we have a general graph showing the growth of the campus in terms of users, and you'll be able to see how much it has grown since the year of 2014. This growth in terms of number of users that are participating in our courses, and this has been connected to the opening of new projects that has happened in many areas of the organization, and also has happened together with the approval of the technical equipment that we have in the virtual field, so we can operate more projects and more users. And here we have something as a key moment, the moment of 11 February in 2020, when we started our first course about COVID-19 and an associated work with the World Health Organization, and how that allowed us to continue growing. Because we did, for many people who didn't know the campus at the time, this started growing. The number of users has grown dramatically since that. And now we have more than 3 million users who have enrolled in courses. So it means since we have more than 3 million courses, that means that they start on a single course, but they probably join other ones. This is a first look in where we verify the presence of medical doctors, nurses in our groups. And there's a strong challenge to keep on growing in the first level of attention, and a percentage of approximately 15% connected to our colleagues that work in the ministries of health in these areas of management, and they are strongly connected to our courses with tutorship. So we have the nodes for each one of our countries. If we have a flag, there's a country which works with us. The Caribbean is put on through a college of our flags. So our countries that speak English are there. And we have a strong focus on prioritizing the capacitation at a local level. We're working together with the decentralization of the offices in our countries, and the work that happens jointly with all the universities of that region. And for us, the work with the country nodes. The work with the country nodes has a very strong importance in the sense of creating all the cultural adjustments and idiosyncratic adjustments that are regarded for each one of those health systems in those countries. And that brings an added value that's central in order to develop and strengthen our opportunities, so that each one of all those countries may have a regional material for the World Health Organization that's being thought out in function of their main necessities. In the next slides, I will be sharing a little bit of what we have been doing in order to get to know our users in general, and how we're doing it regarding our workers. So we can see here that the campus is being accessed by users in more than 225 countries and territories all over the world. Some of our products, for example, in French, that were first taught through ATHI, are then used by African countries that speak French. And the same thing happens with our materials in Portuguese. And the number of users per 100,000 inhabitants allow us to make as an analysis of what is going on in our countries. countries that are prioritary for that. So small countries that you can see represented here, some of the Caribbean, English Caribbean countries, or Belize, or Paraguay, or Peru, or Honduras. And we have our highlight here is Ecuador in number of users, but it's very important for us to check out how we can use the virtual campus in each one of those countries. Another aspect that's central to us at right now, and that I would like to present to all of you so that in the next years we may articulate it with the analysis of those techniques in the campus. It's like we said, the development of capacity in the campus has a focus to check out the changes in these health services. And in that sense, the profile of users in the campus may indicate to us in which city we're working and how we're being able to advance in that sense. And we watch installations of health this professional is working, so we're thinking of some type of capacitation and qualification that's connected to that health capacity in that city. So the training and capacitation is connected together with this availability of resources in that sense. And that always done so we can keep track of the work. So here we have a video, a map of Colombia in 2023. I don't know if our friends who from Colombia who are listening to us were carrying out some work with us. So we're talking about the training that will happen in all of the cities in Colombia, municipalities in Colombia. So here we have a few reflections that I would like to present of you, just a few overview of what the currently educational field that we have here, that gives you an idea of the current work and challenges that we have. It is not new for the people who are in Brazil. It's permanent education of health is a key thing in Brazil. And the World Health Organization, the Pan American Organization. And we've always been thinking about the type of education. We've always been thinking about this type of continuous education and a collaborative learning, this network learning that will happen. And we've always been working with adults in this moment and thinking about these things in a way of trying to solve issues. Our educational focus, it's available in all 4 official languages of the organization, and it's being updated and linked in our perspective, our current perspective, with the concepts of lifelong learning. So creating things that will last for life. And this aspect of capacity building and training, this is something that prepares us to work for 40, 50 years in our health services, especially with changes. This perspective of permanent education in health, it has a central pivot in the work that we're carrying out by creating our formative itinerary, separated by thematic area. And this is very important so we can get to know with our technicians here so we can understand what do they do and what do they can do. So this is to be done presentially for health. And I would like to highlight with all of you with this graph regarding this translation, all this the health system that we have, this health system that deals with that. And in this system, we'll have the diversity of roles, diversity of functions to be carried out. And for that, we need to keep track of that our health professional is doing their work properly. And according to that, all of them will need to develop their capacities and their pathways, their opportunities, and opportunities for the graduation. in order to support them in their certifications, evaluations. So in order for them to think about like our virtual campus, we're completely committed to this perspective of recognizing these micro-credentials. So what are micro-credentials? These are things that are very useful for them in their careers so that they can make them understand like, oh, that they've gone through like this capacity building and mentorship for this type of work. So we have this automated certificate that is created by the virtual campus. So considering our budget in our virtual field, we have like these insignias, these badges that show that they have concluded these courses. So they have this badge that they can share in social media, like LinkedIn, and they can add to that virtually so they can present them and make them recognized all over the professional world, the academic world. And one example of that analytical certificates that we have here, that we're currently developing, so that they will have a certificate of all their formative process that's developed in campus. These certifications that we're carrying out, they have a really strong work that's happening with our country. And of course, all the health organizations and careers have recognized this type of certificates, and also the academic world have been giving credits in their developments due to these micro certificates. From other certificates from the virtual campus, they have been gaining a lot of recognition in all these areas. So for example, here in Panama, we have a meeting with the APPH, the Association of Health Schools in the USA. And in this moment of their meeting, we had a moment of strengthening the competencies, the digital competencies. And in that, we have this opportunity that all of these recognition of those certifications in this lifelong learning have created these keys that are very completely fundamental for the development of our technicians. I was making reference to our work with AASPPH, the Organization of Public Health Schools in the region. So we're talking about our currently collaborative work that's currently happening together with Joaquim Venancio and Fiocruz, and the funding that's happening through our Spanish cooperation. I'd like to just say that we're working in the creation of tutors and teachers in the institutions. Our work together with the Italian Hospital of Buenos Aires that will allow us to develop a course so we can create an educational front for the health institutes. And the references that I had with the World Health Organization Academy to strengthen and control the quality in accordance with the World Health Organization Academy. Well, just so we can finish this and move on to talk about this in the central work in terms of that, I would like to recognize and strengthen some of the matters regarding our network of technicians for health here. And I would like to congratulate them on the work that they have been developing. But in this first point, this is a very heterogeneous set of activities that we have and a diversity of acknowledgements. So in the end, it is a total key for us to have this work together with you so we can advance in valuing the technician and have more opportunities for qualification and capacity building for our technicians. It is a challenge to track every one of our technicians in the Americas, and we understand that we have a lot to grow in that sense in joint work that will happen, especially with the technicians. With all this information that we have, this is our database. They're maybe not so precise, but especially in the second part of our meetings, we'll get deeper in this type of knowledge so we can improve that. But here is some data. We believe that about 15% of our campus work they identify themselves as technicians. we need to get deeper into that because most of them are working in primary healthcare. And we also have a few examples, like in Bolivia, because our colleagues in the rural zones in Bolivia have reported difficulties to check the educational offer of the virtual campus. So a great part of the joint challenge that happens. And with that, I would just like to finish my conversation here. I'm not going into detail because you'll be working with that, but the general goal of the work that we're carrying out with the Polytechnical School, with this joint work that we're carrying out, this first step here is about characterizing the profile of our technicians in the virtual campus with a detailed analysis of and human resources. This is a central thing for us because we really need to understand what is the profile of our health technicians and that they can go through the virtual campus easily. And this will allow us to give us more pertinent decisions regarding the opportunities that we have for them. We would really like to improve. We would really like to improve, and this is shown here in this second stage results that we have here. We would really like to improve the identifications of the pedagogical strategies that we have and that we need to include in our course. So how can we improve our didactics of our courses? And we need to discuss if we have like specific courses for that. So it's a clear thing, it's key for us in the next stages so that we may analyze the data, and those numbers in a very detailed type of work. And then the value of that network will be central so we can understand who needs it, who is using that, and what are our strengths and our weaknesses regarding the future. And I would also like to say that we have it together with the Spanish cooperation. I was in an activity to participate in their communication recently. It is central to us to think about how do we get to them? How do we communicate with them? How do we put ourselves in the field? How do we start interacting with them? How do we deal with that? So in this moment of improving our communication is fundamental in the next moments here. So it's important to understand that we have an analytical information that we found together with the technicians that we have at our campus and the first recommendations that you can make. And as I've mentioned here in the next stages, we have a huge focus in the pedagogical strategies that we have to develop and strengthen. And with that, I would like to celebrate our first webinar with this opportunity to actually present the first information that you have about these things, and also our colleagues that are listening to us on the internet, that they would like make suggestions and ask questions about things. So what do we need? What do we expect from our results? A bigger alignment of the offered of courses of the CVSP, a better use of our current courses based on the technicians, based on their use recommendations, considering who uses it and who doesn't use them, which courses they start and which courses they don't finish. A bigger knowledge of the virtual campus by the technician workers of the regions through the definition of strategies for communication and diffusion of the CVSP that are exclusive to this collective. So we have arrived here. Let me say I would like to thank everyone here for this opportunity of sharing all these things about a virtual campus with all of you. But I thought it was a key thing for all of us, and thank you for transmitting this on YouTube. And part of the work that we're doing, and we would like to work and our things here with the technicians, but we'd like to open this opportunity for all of you so you can track the field and understand, track the campus and understand exactly what we can do. We have this material on the app, on the phone, so we can check it any time. For those of you who do not have the app yet, I would like to suggest you to download this app, and that would be our recommendation. Thank you very much. I hope I haven't exceeded the time that I had. I think I'm 2 minutes over time or so. So sorry for all of you if I'm over time. And let's go now to the next presentation. Thank all of you. I will stop my sharing my screen. Thank you. We can't hear you, Carlos.
Sim. Desculpe.
Oh, yeah, sorry.
Gabriel.
No, so no way. Gabriel, your presentation was amazing.
Te agradeço muito.
I would like to thank you very much.
Muito interessante.
And for all of us, it is very, very interesting to realize how big and how wide and how far it can reach, how far our virtual campus can reach. It's very important, especially for the workers that are in areas that are more remote than others, and the possibilities that the virtual campus gives, especially for these people that are in remote areas, and in general for the strengthening of the health systems. And that gives us the dimension of the great tasks that we have as a research group. We as a research group, we are so involved and engaged in these systems and in this approximate point of view here with all the technicians that are currently enrolled in this, what are the profiles and what are their trajectories. And it's in that sense that we're going to walk in. And it's very important for us to realize that the difficulties of working with these information systems, these are not recent phenomena. We have a historical difficulty in the work with information, especially regarding health and with the technicians. Because the technicians are made invisible in the health systems due to their precarious working conditions, their problems regarding their connections, and the information systems end up being insufficient in terms of how they are backfed all the time. So it is about that too. We have here the opportunity of having Dr. Ana Paula Cavalcanti from the Human Resources of OPAS in the WHO. She's going to talk a little bit about the visibility of the technical occupations in the World Health Organization's account, so the challenges that they have for the parametrization and normalization of that data. So welcome, Ana Paula. The floor is yours. So am I able to share my screen? Is it working?
Sim? Ok, obrigada.
So let's go. First, I would like to thank you for this opportunity of being here with all of you in this webinar. In this presentation, we'll talk about the necessity of parametrizing and dealing with the health organization. So we'll be talking about the standardization of data between the technical roles that we have between those countries and the ones that are collected by national accounts. So with proper planning and managing and creation of policies for the creation of a workforce in health that's adequate to the needs of the population and the health services in those countries requires information that's reliable. And in that sense, the WHO in 2017 has created the National Health Force Accounts. It is a tool that allows countries to standardize and improve progressively the availability, quality, and the use of data regarding the human resources in health. The concept of the national accounts is connected to this national overview of the health sector in order to deal with the universal coverage of health. This conceptual framework, it allows us in the creation of policies regarding the production of this workforce, entries and exits, and also distribution and issues regarding the regulation of those professionals. In other words, it also helps us in order to extend our view beyond the health sector. And it incentives the discussion with other sectors. And how does that work? How do the collection and dissemination of information works? The data is collected by the platform, by the focal points that is named by each one of the member states annually, and this followed all the rules and standardization by the accounts and their indicators. And that data is then evaluated through a process that includes analysis of data, triangulation of information, and other methods where the differences and disparities that are identified is verified. And the World Health Organization also deals with that data through external bodies like this OECD, and this is then validated in several portals like the World Health Data Hub and our several global websites. And it's also published through several different publications on a global and regional level. So with that, the national accounts is not a product that only belongs to the WHO, but it's a process that's dealt by every country. That's part of it, with the role of not only including data in the platform, but also using the information that they collected to make the discussion easier and improve decision-making based on that evidence. In the Americas, we have 41 countries with focal points and 39 countries with data that's available in the platform. In this map, we have the categorization of the countries according with the last year where they have data available for that, considering all the modules and indicators that we have. It is observed that globally, about 68% of the countries have data available for the last 2 years of 2021 and 2022. In 2018, from 2018 to 2023, we have multiplied more than exponentially the number of data that was available, the amount of data that was available in the platform. And this goes beyond all the stock of the occupations that we have. The availability of information that we have for indicators like sex distribution, age group distribution, facility type, place of birth, graduates, number of graduates. And in this graph, we are able to see what type of information we have in percentage for each one of them for the main countries, and the number of occupations and roles for each one of those countries in assistance. And for some countries, they have more than 40 different occupations and roles. When the evidence system of the organization is keeping track of this process of implementation of the national accounts in the region, one of the points that we have worked with them is the verification and validation of the focal points of 17 different indicators, including the several ones that are available in the national accounts, considering how real the information was, how verifiable the information was, and the global developments. So we created indicators that are verifiable and relatable in a global scale. All these indicators, when they are available, they're made available in 6 different areas. In the characteristics of each one of those professionals, like their density and the distribution of those workers per age group and sex, type of establishment and facilities, be it private or publicly owned. We're also talking about the workflow of the workers regarding the place of birth and place of qualification, combination of competencies, capacity buildings, qualification, and a relationship between the numbers of graduates and the stock that we have. Without indicators, 4 of them are considered essential. So regarding the professions and occupations that we're suggesting them to mention and inform all of us, so in addition to nurse, dentist, pharmacist, doctor, we also medical doctor, we also have a lot of work in terms of the primary care is identified, especially during the pandemic. Community workers, physiotherapists, and psychologists. Many of those roles, they have a fundamental role in the universal coverage of health. So in that sense, it's very important to use the national accounts to understand and plan the workforce in addition to the classical professions that we have here. And we have the possibility of collecting information for 42 different jobs in the national accounts. In addition to those 5 jobs, the countries that have most information for assistance and odontological services. And on the other edge, with least information, we have workers about the engineering and maintenance and personal care, personal health care at home. I would also like to highlight in this graph that the countries that have information regarding the technicians are the ones that are in orange color, and nursing is in green because they are accounted in a joint manner in the platform. The classification of the occupational and risk services is carried out in order to carry out like international occupations and data, occupational data that is compatible internationally, and it also allows us all the different teams that are here. And it allows us some type of information so we can standardize these occupations. And this is an instrument that helps us in the parameterization and standardization of data regarding the health occupations in national accounts. In its basis, we have a few concepts like employment and competencies. So in that, this employment and work situations is set as a group of qualifications that is connected to the employment connections. And this is changed to the level of complexity of activities that are performed in that job. With that, we're dealing with 4 levels of competencies. So the first one is carried out by physical work or manual work that is simple, that requires the first level of basic education, up to the 4th level, that is works that require decision-making, solving complex problems, based on areas that require a lot of theoretical knowledge and practical knowledge, including the 2nd and 3rd levels of higher education. In the 3rd level, we're talking about technical work that are complex, that requires a set of technical knowledge in a more concrete manner by collecting all this information from different occupations regarding the density of 10,000 inhabitants per occupation. So this country here, for example, before 2015, it had information only about the medical doctors, dentists, and nurses. And currently, this country has information for many other occupations since 2015. In 2021, it had information for the density of 30 professionals and 30 occupations. So here the national accounts in these countries, they are helping with the density of information of 15 health occupations. And in general, the countries that are making the information more available, they get more relatable information as well. And that's And in terms of data collection, in order to get quality information, it's very important to identify the working occupations and to standardize them according to that. The normalization and standardization of those occupations, it goes beyond all those aspects in national accounts and the time that we spend studying that occupation. Here we have one example for all these medical and pathology laboratory technicians, that in addition to the definition that we present, it's also important to observe all the tasks that this occupation carries out and the examples that we have in those occupations. We also have a more concrete example with the countries that have when they try to put this information regarding these technicians and assistants for the labs as well, because the definition in ISCO is that they carry out clinical tests in fluids, in bodily fluids, in order to obtain information about the health of a patient or the cause of death through the operation of equipment that is specific for the analysis of biological material, including blood, urine, and spinal fluid. And the country in this example, they have identified this definition, and it's carried out by lab technicians and hemotherapy technicians. So more than one job is carrying out the same definition. So we can check the development by this example here, the creation of these occupations that's carried out by one, and then in addition to other professions. And also the types of terminology that's carried out using all these different concepts in different countries, and it may have different meanings, like the assistant or assistant may have two meanings there. That can have like an assistant and sub-assistants. And in that case, OPAs may also have different activities with the countries in order to improve their capacity building of their information systems regarding the human resources for health. In order to support this health and development in that region, some of those activities include the mapping of some of these occupations together with the countries, and in partnership with the Collaborative Center in Brazil by using the methods for the standardization and equivalence of the national health jobs that has this as its basis. And this will also help the countries to analyze that, to see that the data that is being analyzed is done consistently. Then we also may verify the different roles and function of every one of the health professionals in the Americas. So I would like to thank you everyone for the attention and to wish you all a very good, productive seminar. Thank you very much, Ana Paula. For us who are now dealing with this team and all the technician workforce in this healthcare, and all of them who have become part of the virtual campus in health care, it's very important for us to get to know how the national accounts work and to understand the size of the challenge that's being faced by OPAs and the World Health Organization in order to seek this quality information about our workforce. I believe this research that we'll start by sharing our partial results here, it provides this type of effort that we have in order to, in a more deep way, in order to understand this workforce. I think this presentation will be available in the video for a webinar, and I believe this will be a very important resource for all of us in order to get to know this type of effort. Our webinar is currently divided in two parts. We're closing this first part. about this general overview of this parameterization work that's starting with the WHO. And now we're going to go through with a brief pause so we don't get too tired with so much speaking, so that we can watch a few institutional videos, especially by the Polytechnical School and the virtual campus. So I would like if all of you could start with a video from the Polytechnical School. I would like our support now from our health video team.
Educação como processo emancipatório que se insere nas lutas pela transformação da sociedade. Democracia participativa,
transformation, participative principles, the commitment with the ethical question of gender and environmental production and democratization of knowledge. Those are some of the values that are experienced in the Polytechnical School of Joaquim Venâncio, created in 1985, and really call us Poli for all the ones that come here. The name of school, it's an homage of the most important technician of Fiocruz. He comes in 1993, becoming a reference between the laboratory assistants of the institution. His challenges as a Black man represented fully the reality of men and women of the country that need to overcome in the qualification and education process. If you lost in the idea to have a school inside Fiocruz, do not feel bad. You're not the first person and won't be the last. So think in a place where all the knowledge that is produced has a goal, the reduction of inequities and social inequalities through the strength of the Brazilian health system. So does that make sense now? We are an institution that has a mission to promote the professional education in health in the surveillance area, attention, information and register, management, labs techniques, maintenance of radiology equipment, and a post-graduation program in this interdisciplinary area that aligns a lot of other education. The school is also a collaborative center of WHO, developing technical cooperation in this field with several countries. And it's an executive secretariat of the International Network of Health Technician and subnetworks. And through that, we produce and disclose knowledge in the work and education and health areas by the bimestral edition. Publication that's available to all the subscribers in the country that publish original in the education and health fields. We are also responsible for the Observatory of Health Technician, a strategic space of development of study, research, and the dissemination of knowledge, and we still coordinate the scientific that allows the young of high school the experience in the field. Understand something fundamental from life. We act with social programs, and another institution try to insert the education in the fights to construct education. Do you think that's ended? We can see what happens daily through lots of smiles, friendships, and futures with a lot of possibilities. You can know more about with the epsjv.fiocruz.br and follow us in the social networks.
El enfoque educativo del campus virtual es el marco conceptual y metodológico que explica, orienta y prevé los procesos y los resultados educativos. Bajo este marco general, vamos a diseñar las intervenciones de formación en el campus virtual de salud pública. Nuestro enfoque educativo tiene dos pilares fundamentales: la educación permanente en salud y la enseñanza-aprendizaje en entornos virtuales. La educación permanente en salud es la educación en el trabajo, por el trabajo y para el trabajo en el ámbito de la salud. Su finalidad última es mejorar la salud de la población. Es una herramienta privilegiada para el cambio institucional, que debe incluirse en una política institucional más amplia. Son principios de la educación permanente en salud. El aprendizaje como fenómeno social, aprendizaje en redes. El conocimiento como construcción colectiva, producto de la interacción entre contenido, grupo y la mediación del docente. El proceso reflexivo y dialéctico sobre las situaciones de trabajo. La identificación de las necesidades de la comunidad junto con el análisis de los problemas del trabajo. La integración del conocimiento y la experiencia. El conocimiento y la
integration of knowledge and experience. And the education experiences to support the learning shape. The studies of learning are showing that we change through the perception of a problem. When we understand that in this way, we can face the challenges. Transformation comes through a sensation of community and the production of the living experiences. So the virtual education has a request, and we have that as a modality that has been present in the education. So it may allow the transmission, unilateral transmission, in which the technologies to deliver context and the point in the collaborative production and the relationship between the user in the digital space is possible to have commitment from persons and learning. So here the education process delivered information transforms in a common territory with context to build new knowledges. In the virtual campus, we can consider that the proposal of qualities where we generate an encounter that promote the critical thinking. And here we have experience of
equipos de salud
and on flow of exchange. The virtual campus of public health, leading the practical to the theoretical to the practical.
En el año 2003, la Organización
In
Panamericana
2003, PAHO had an additional step in public health, a technical cooperation tool to all people in all places. So the virtual field campus contribute to the health personnel and improve the population's health. During 20 years, the virtual campus has educative proposal that talks about the priorities in the region. Since its beginning, we developed over 2 consultations courses and over 500 courses in the countries. To those educative proposals, the virtual campus go all the country to educate tutors. At virtual campus, always batch in collaborative center through all the countries. So to that, the development called us as countries an opportunity to go through and training the personal work, the health workforce. Virtual campus keeps the commitment with innovation between 2006 to 2013. We have an advance in the technology to create different kinds of courses and the certification, automatic certification of certification, the sustainability and the possibility to grow in those courses. Those advantages allow to have the virtualization weeks during COVID-19, and it's fundamental to the technical cooperation. Since the beginning of the pandemic, we have 36 courses regarding COVID-19 and support this action that was necessary. Over 806,000 people were training during COVID-19 with 2.4 million users. Virtual campus are over 200 countries and territories. Majority of the users are people of the health systems, and 68% are women, and the young users, 57% has university education in nursery or medical school, and 37% the first primary healthcare. Looking at the future, the virtual campus will have the resilience in the primary healthcare and working with collaboration to the academic institution of America to ensure the access to these fields. Every day better, the health workers will be the goal of the next year, seeking always to promote the academic excellence and training health people without leaving anyone behind. So we are back. Very beautiful videos that bring the opportunity that we have to extend the participation in the health technician and the virtual campus of office. It's important to say that this project comes from the articulated process from the virtual team from the campus through Gabriel Stovix, and the work very important of Isabel Dure, Mônica Duran in Opus Brazil, PAHO Brazil are fundamental people to develop those projects. So it's important also say to highlight the support of the Spanish Agent Corporation. So we like to give the floor to Fernando Taves and Fernando Santoro, that's going to present the first results of our research and the methodological paths and the challenge that we are facing in the sense to work with the base of the ones that are in the virtual campus, the issues that we faced, and then Gabriel Mostavsky is going to bring us the first results, the first process that allow us to observe with a little more clarity the technical pathways of the health technicians that enroll in the virtual campus. So I'd like to call Fernando Santoro to the first part of presentation, and then Gabriel. Good morning. I will share my screen, and then if you can let me know if you can see the screen, if you can hear me. Is everything okay? Can I start? Great, I'm going to start. So once more, good morning to you all. And the goal of this quick presentation is to present preliminary results regarding the profile of the technicians that use the virtual campus of public health. So to that, one of the stages of the subscription of the professional is a field called profession. In this field, they can choose between several options, and if they don't feel that they belong on the one of the professional, they can select others, and in this option he can type her profession, and that's the work that we did, that was try to clean those data of professionals that declare themselves as others and typed the profession by themselves. And that's a problem in the analysis and the data treatment, because a comma or a punctuation sign has a difference when you select one of the items of that field. So that was the work. So to that, we developed the following methodology. We start with a base that we have 6,797,391 enrollments, and as a time horizon from April 19th of 2008 and February 2024. That base contemplates not only the technical field. Okay, now it turned. Is there any problem on the presentation? Fernando, we can't see, but now it's regular. Can I go on? We see the process of data process. It has two information, the complete base and the first filter that we had. Okay, I'm going to go on. So the first filter that we did was the part of the students that attend the modality of self-learnship. We didn't analyze the other modalities, just the self-learning. And the time frame from January 1st of 2019 and December 31st of 2023. And in this cohort, we had 3 periods, previous pandemic, and post-pandemic. The previous pandemic from 1st of January of 2010 to March 11, 2020. Pandemic from March 12 from 2020 till November 25th, 2021, and post-pandemic 2021 to 2023. That's our time cohort. The next step was to make a filter in the column of professional only with the professionals that chose the other option. All the professionals that declare regarding travel professional weren't part of this process of cleaning the data. So with this filter, the base that started with 6 million, over 6 million, and dropped to 5 million after the first filter was reduced to 1 million to 118 enrollments. So the next filter was to filter the ones that select in blank, others, or technicians. So we took out the professionals that self-declared, doctors, masters, graduated, or any other kind of education different from technicians. So our universe become to 531,343 enrollments. And to do this process in a manual way, it would be a very big time and possible to have some time of mistake, because it's a human process and allowed mistakes in this kind of data processing. So the next stage was to reduce these numbers of enrollments to exclusive values. A person, for example, can declare nurse technician, and other person can declare themselves nurse technicians. So we have the work to analyze two subscriptions. So we had a process to cut off this amount with the quantitative of over 41,000 enrollments. And so we can expand to this horizon of over 531,000. So we started the process eliminating registers in which clearly it wasn't possible to select some kind of professional points, numbers, letters, only the letter of the alphabet ABC, because when people was obligated to type something, sometimes they type dots, dashes, or any kind of characters, and it was impossible to obtain a correlation with the list of professionals. So a first step was to clean those characters that were impossible to identify as a professional. And then we treated in which we had a negative keywords list. And in case the person typed a word, a term in that list, automatically it will get a warning, and we won't take a look manually did that register. So professional of university, we include lawyers, accountants, psychologists, doctors, and all the college levels professionals. We have an idea of the terms that wouldn't be possible to identify. Some people typed curse words, bad words. Some people typed "I don't care," so that indicated the exclusion. So with that, the number of 31,000 reduced to an analysis, human analysis, let's say like that. So the goal of this stage is to select negative words, and that those words had impact in the list in which we made the process after comparing with professions. So in this list, we faced some acronyms. So it's very likely that the person should declare their professional type only the acronyms and not a whole text. So we made the study of that in this stage was going to be debated to see how to proceed in those registrations where people declare through acronyms and not through the profession. We are on a hold on this stage. So after we clean the registrations to be excluded through a semi-automatic process, we did the first restudy to try to save registration that were in this universe of the excluded registration. So to that, we made a positive word list. For example, negative words would be doctor, but there are professional to doctor. So when we had an exclusion process, all the registration that had the medical term in the register would be excluded. And the term paradoctor, it's a term that we can still have. So we have this positive word list, and in all the process, both process, the terms were written in Portuguese, English, French, and Spanish. So in this stage, we took the registrations that were excluded from the first step, and then we have the process through positive words to see how many registration we would save. And beside that, another kind of restudy comes from a column where the people type the place where they work. So we had a list of terms, and if these terms in the column, in the place, with the name of the place that the people is working, if the person typed Hospital Salgado Filho, the term hospital give the warning that shows a result to include this term in our manual process. So finishing the second recap, we establish the table of classification, and this table was translated in the 4 languages. And to finish it, we made the process of classification that we called the para, of the registration of the people types freely to the code. And this process was one of human analysis, a manual process. We had some support of technology, but it was a process to analyze register enrollment by enrollment, and we correspond to the correct account, and then we can exclude some registrations. So finishing all this process that were over 3,000 or 4,000 analyzed registrations, we made the opposite of the first part, where we cut off the registration and then we expand to the whole universe of enrollment. So with that, we recover 153,622 enrollments. That is equal to 29% of all of our universe that were the over 31,000 enrollments. So the process, as I mentioned before, is a first analysis, and it's going to be made again. But in this first analysis, we can recover over 153,000 enrollments. So with that, I end my participation, and now it's my colleague Gabriel. Gabriel, I can't hear. Thank you, Fernando. I'll ask the following slides. I greet you. I thank you, people from PAHO and the Virtual Exchange of Public Health and the Polytechnical School. Joaquim Venancio, it's a pleasure to participate as a consultant in this project. And I would like to highlight that we are going to make a technical analysis, a first analysis of some points that we made, and the time of the results about the technician. As Fernando explained, we classified in the period of 2013, 2023, we are going to see some difference in the number that were presented in the first stage, in the first part of the presentation that Gabriel showed. As Fernando mentioned, we classified the different occupations of health technicians that present and subscribe in the virtual campus of public health in 23 codes of the 008 risk. And then, as Ana Paula Cavalcante explained, the 0.8 risk of the international classification of occupation that allow us to exchange information regarding researches, statistics, and informations regarding occupations. So we had 23 occupations that we have and identify with the codex of 4. The first number is regarding our technical works in general, and the second number, the health technician, and the third number, the 5 smaller groups, 5 denominations of the health technicians. And finally, the last digit has to do with the occupation that we have here. So we can see as we gather the ambulance, the labor, the doctors, nursery, the high school level, high school nurses, technical labs, technical nurses, prosthetics, treatments, sanitary documentation, pharmaceutical, physical therapists, community workers, personal carers, and social assistants in technical social assistants. So these are the group of the service workers. That's why it's about the first digit is about the first digit. And the social, one of the social service. The analysis of the universe in this time frame are over 340,000 technicians, and the universe at this moment of 2000, 2 millions, over 2 millions. So the technicians represent to this time frame over 15% between other ways. And in another way, the technicians represent almost 16% of this analysis universe. And the term over 340,000 generates over 800 enrollments that represents 16% in enrollment, not declared. When we want to see the distribution according to the profession, we dedicate to do it between pre-pandemic, pandemic, and post-pandemic. And in the beginning, we can see that almost 72% all the technicians that subscribed in this period pre-pandemic were from the group of the nursing. Things that didn't change during the pandemic and that increased during pandemic. So almost 78% of the personnel were from the nurse school. The other groups are the community health workers. That the medical labs 2.70%, medical secretariats and the administrative field 1.84%, ambulance drivers 1.60%. Always remembering that this has nothing to do with the distribution of the workforce, but with the people that subscribed in the virtual campus of the public health. So here we can see in a graphical way how we can have the prevalence of the nurse sector and the technician sector after the pandemic. We have 70% participation regarding of 70% of the relative participation. That implies, so we can have to have a post-analysis, we have to separate the nurse school and analyze the 21 left codes to see its particularities that we have in the sectors. So here we are going to see the increasing in the virtual campus, the process post-pandemic. As you can see in this increasing, in terms of people, over 28,000, we went to over 200,000 after the pandemic. The same with the enrollments that comes from over 63,000, increased of over 400%. this increase did not change the average of the average 2.17 each person enrolled in courses in the average. To characterize the group, we can see that in the pre-pandemic, post-pandemic, we change in a relative way the optimization, and almost 65 to 66% of the user are under 40 years old. And that didn't change the different moments pre-pandemic and post-pandemic. Regarding genders, we still have the trends of the health systems, the health professions, and over 80% of the technical user are in the female gender and 20.4% male gender. I could say that in general, because of the usual numbers in health, it's familiar the user of the virtual campus. It is interesting to see by country that the subscription of the technicians, we can see the change pre-pandemic, pandemic, and post-pandemic. In this sense, the first important data, 82% of all the enrollments is about three countries, the main countries after pandemic: Mexico, Colombia, and Ecuador. And it's also important for us to see in each way can produce changes. And you can see pre-pandemic, Mexico, Ecuador, and Colombia that are in the first places, and Colombia has 18% of relative participation after the pandemic. Mexico consolidates with a percentage of 42%, and Colombia duplicates the percentage participation, taking the second place. On the other hand, it's important to see that the first 10 countries in any exchange are 95.4%. So these first 10 countries are regarding 95% of the enrollment, and that's another point for us to analyze in the future. So it's important in the next stages of this project can analyze country by country, because as you can see, there are countries that increase in a percentage way that could kept the growth in a percentage that have reference to the totality of the countries. In Argentina's case, we went through 16% to 3.37% in a percentage way. So an analysis of this country, the development in the future will allow us to analyze the best practices. Regarding the workplace of those people that we define as technicians, we can see that almost 37 to 42% between the pre-pandemic, pandemic, post-pandemic are about workers in hospitals, and the health centers of 5% approximately. In this case, we have to remark that we can modify 25% of in these results. So regarding the process of public health, this work in the future, we can obtain and allow to identify that the ones that enroll the hospitals versus the ones that enroll in the health centers. Another important analysis is the one of the courses that had more enrollments. So it's interesting for us to see that the pre to COVID-19. And we can say that 70% of the course that we had from the technicians were regarding COVID-19. in which it has a lot of projects. And post-pandemic, you can see again the virtual care of palliative, the course, the cancer package, medications, in the precise automatic medicine and blood pressure related to the disease as diseases as dengue and the ones related to COVID-19. So with the return of the pandemic, return to the first place to disease that has an extension of distribution in Latin America. We would like to thank to all the team that worked, Fernando, Carlos, with the help of this data analysis, we like to open the debate, saying that we have the preliminaries to the necessity of adjustment, analyze the best practice, and not only they should to look at what we don't have, but the best practices made the improvements possible and the improvements of the participation of the technician in the virtual campus. That's going to allow all kinds of information, implementing the participation of different technical fields in the virtual campus. Thank you very much. Thank you, Gabriel. Thank you, Fernando. I believe that these first results of this preliminary data of the research present a series of issues that provoke us to do new questions, to seek new crossings between those informations in a way that we can characterize with higher precision the ones that are the technicians that access the virtual campus, the education pathways. So we have a group of first analysis that could be very rich. So I'd like to invite our fellows that are here with us to the debate, and the one that hears, we have some questions. And I would like to say that mainly we'll have the privilege to have from virtual campus, Isabel Dure, Edgardo, Marita, Scarly, from the Human Resource Unit, Ana Paula Mariano, and from the Human Resource Observatory, UMS Décio, Santiago. We have some fellows from the Technician Observatory in Health of Public Technical School, Isabella, Yale. So we are here with a team that's very qualified to do that dialogue. So immediately I would like to invite the ones that want to do the first comments. We are going to try to organize the debate, and we are going to follow the social networks, social media, and our audience in YouTube. It's open for the ones that want to comment.
Isabel quer fazer
I don't know if Isabel would like to do the first considerations to start the debate. Muito obrigada. Primeiramente, eu vou obrigado. Thank you for the work that when I see the presentation, the consolidation is a very big work with a lot of respect regarding the virtual campus. So I'd like to congratulate the project team. It's a very important work. I can say that with general considerations that are not specifically similar to the data procedure. And I believe that we always have challenges ahead of the technician, and that's registration of work and systems. we faced, being a part of a challenge that we face, as we can help to standardize the categories. And when we do that, we favor the registration. So we take some advantages because somehow to give visibility to registration. And at the same time, what shows is that the global standardization and global way to face another challenge is not to lost identical characteristics, that I believe there are two necessary conditions to visibility. As Ana Paula mentioned, we need to have more information to spread in a global way to summarize the role of technicians. And it seems that we need in the categories at the same time the challenge to recognize and have the characteristics of the profiles that we build through the pathways in each country. And it's regarding the interprofessional professional categories, the capacity of response. And the fact is that the work done by the project team that we had, it was a very complex situation. We have the virtual campus data and the standardization that we promote in the bodies of the United States and the team. And those are the standardization that we need and going to allow us to gather to the technician. And the difficulties that we face, the technician, to self-include in something of those categories. And the information, the international information not allow a better identification of the professional. And then we can reach the challenge that we have in the virtual campus, that we want to reach those people that we reach to count on general information, and at the same time that the people can be included in those categories, because that's going to allow and questioning what we have from a perspective, not only that. And it's also a start point of the identification of this perspective. So we can say that here it's a question of conviction that I have according to my work in the national school, in the virtual campus, the necessity to increase information, standardize the information. And this is a parallel challenge, and it's going to be a big work in the technical institution to go deeper in the characteristics, professions in the local level. So at the moment, to me, it was a process, very interesting process, the standardization in an overview. It's important to take all the work that you just showed, and at the same time, how to work together to everyone can recognize in the categories. As a comment and as a question to Paulo regarding that, the work of the countries, what are the difficulties that emerge from that? Ana Paula would like to comment. Isabel, answering the question of Isabel regarding the difficulties, while seeing the presentation that was presented regarding the countries that presented the information regarding the definitions and the occupation in the national accounts. I think that first of all, to reach all the occupations or all the ways of presentation in the several countries is a very complex task. It's hard to reach perfection in an extended way and the occupation in the different countries. And I think that one of the biggest difficulties, the first look in the name of the professional itself, that sometimes we do not overcome the difficulty I see, I live in Portugal, and I have the classic story of bachelor. It's not a university level. And if you mention bachelor, they perceive as a non-professional. In Brazil, bachelor is a professional. And I think that's the power of the word. And the difficulty is when we come through a translation of universe, the translation to Portuguese and other to Spanish. And the Spanish is different in every country. And one of the main difficulties, and one other in the case of the national account inclusion, from where to identify the professionals. When there are health professionals, there are the necessity to have a subscription in the professional counselor. So is other source of information that we can take of the amount of professionals in the country, while the technician, they don't have this demand. So we have a big challenge to use as a less number of database. So it's more about the establishment of health. I didn't compare the presentation, the difficulty that we have in the use of the types of places, facilities that, in other words, it could be a mistake presented in a hospital, but doesn't have a admission, the number of beds. So we have the standards, the documents that help us in the using of that in a certain way when they present the necessity to inform this database and the synchronization of terminology and the representation that each page presents and the complication, and everyone comes with their framework referential of what that represents and another referential to analyze that information. So that's it. Thank you. If I understand, Décio wants to make a comment, and Isabella to make a comment, giving following to this debate. So, Décio, I would like to congratulate the work that you are doing. It's a giant work. You are coming through a base that was open in a proposal of work to try to understand the reality of others. So we are coming through to collect information that's done through people that subscribing at the portal. So people are arriving there, moved by a desire, demand something. So that's sensational because this information is collected from people that are interested to get there, different from the information that comes through the registration of the profession. That's mandatory information. So are two different natures of information. The capacity of this portal system to capture the granularity of information is higher. While I was hearing you, the presentation, I was thinking the work that we have been developing regarding the nursing demography and how it's difficult to picture the public institution. I'm going to use hard work, how a course can be offered that information to build a demographic plan, because I was thinking while hearing you, it's not I want to make the comments. I would like to add another level, another layer from what Ana Paula mentioned, and trying to do this work, which is the local culture to be beyond the name. People have very strong convictions, so the semantic field of a name is not the same in two different places. Ana Paula had the example of bachelor in Brazil and Portugal have the same language, and the semantic field is different. When we change the language, that goes deeper. And more than that, we have places in certain activities that are in the university level, and another was under two others. So it's being established in a way that many times the grade in the sense of stable, it's not, we have a hierarchical subordination issue, legal and cultural. It's legal exists and cultural exists, and turns in a very confusing way. My wife's a therapist, and in some countries of the world, the freedom of actions of the physiotherapist is under the doctor. So the physiotherapist, it has a prescription activity prescribed by the doctor. It's not like that in Brazil, so that changes. In another country, physiotherapist was a high school, a technical professional, and now it's a university profession. So to conciliate those table of professionals is a hard task, and it should be done in several layers. We treat the first data, let's say in quotes, mechanical, that could be done by the computer, the names, and every place is going to have a discussion with people with that place, more than one, because they have different kinds of cultures and values, and could bring different interpretations to understand what is what. So we have to go to every place understanding what made the different kinds of professionals. So we try to create several categories that overlaps, and they are competitive between themselves. To talk with people is not always easy because we have a emotional charge of the competition backgrounds. So that's a very, very interesting work that's not just database and demands layer by layer. We can peel this onion so we can reach the middle to understand how every country, every language, every culture interprets the information, values the action that people are doing. Recently, I saw a discussion regarding specialities and especially nurses, that at the first moment seem something good, but people that put a concern that bring a specialist to nurse is a strategy to reduce the payment for regarding that activity that usually is made by a doctor. So the names start to be very complicated because people don't value the names. So that impressed me very much. So I would like to compliment you, learn with it. Thank you.
Thank you very much, Décio. We also have Isabella and Ana Maria here. And it's important to get Décio's speech so we could see how much it's related to the frontiers of our professional roles and the history context that we have in the constitution of the national health systems. I believe Isabella could speak a little bit about that and our experience with the observation of technicians, with this perception of the health establishments and facilities. Right, Isabella? Then we give the floor to Ana Maria. Good morning, everyone. I've opened my camera so I could start talking about that, the national accounts, and the international codification of the CEUO. Because there is a correspondence between that type of work with the technicians in health, and Décio's and Ana Paula's speech deals with that complexity that we imagine is behind all that dynamic of regulations, be it in education and also the professional health field. And it's a very brief question, of course, but I would like first to congratulate all the presentation and all the conduction and of this event. But I was thinking about this necessary update of the process, this update of the process of the international uniformization of classifications, because we understand that our recent experience has been an exploit of like the National Registry and the National Agency of Occupation in Brazil. We've created a whole survey of all the workforce and health techniques here through our observatory. And it's public right now in our website, so everybody can get to know it.
Complexidade colocada aqui dessa classificação. E o outro lado, minha outra pergunta.
All the complexity behind it. And the other question that makes me uneasy about it is how we can deal with these teams of all these courses that are currently being offered in the virtual campus, and how that construction is actually, blocking, the registration and the interest of people, be it in the technicians level and also higher level, but mostly technicians since we're dealing with that right now. But those were the two issues that mentioned me how we should talk about this debate. And also this trajectory of the observatory that we have been working through right now. So thank you very much, Isabella. I will now give the floor to Ana Maria. I don't know if Ana has already mentioned it, but you and Isabella and Doria have had in this aspect of Mercosul research. It's also a perspective that it's in touch with this debate that we're having right now. Yeah, actually, we could be talking about this for a long time because, well, there's so much discussion about it. I think the deficit makes us think about all this thing because we're looking at, dry data, but there's a whole history of these fields, the campus, the occupations, and how each one of those professions has been organized in each one of the countries. And I think we have this, we can connect that to, like Darcy was mentioned here, we have connected to the GP11 from Mercosur as a way for us to define how we could define the professional curriculum for those occupations in a way of organizing it according to the regulations that we currently have and those 5 occupations and those plans of courses and attributions that we have here to understand how these professionals could, circulate along the Mercosur countries. And then we started facing situations where they are comparable in some ways, but we have also other situations where they are not comparable. They are forms of organization of the work in health that are completely different from each other. Something else that I would like also to mention that was a surprise for us was that based on the information that Gabriel shows us on the search for courses, is that in the post-pandemic, for example, palliative care is the 4th highest search for courses. And I would say that because here in our school, we have started a work for prospection of new profiles for technical formation by checking out the situations that we have by mortality. And we're also looking, of course, here to our national healthcare system. And this area of palliative healthcare demands so much from us. And Isabella is one of the people who have studied this quite often, also the area of care in general care. And when I see represented there, this area well represented there, I understand that the workers from that have been looking for it in order to improve their qualifications and capacity. So I understand that this is an area that we need to improve because people are looking for it. So by getting the data that we have, we understand how this is organized. But in addition to that, and now I'm thinking about of things that are, maybe in line with what Isabella has mentioned, in the way we are organizing things in the virtual campus, if we could also, I don't know if that's offered, it's offered for them, in what moment is that course being set in the platform? Because maybe we had a repressed demand, and then the course shows up, and there are so many people waiting for that course, and then they act on it. So in the moment that course is made available, may interfere with the profile of the people who are looking for each one of those courses in each one of the countries and regions. So I'm impressed in how little time you two have done that. I really congratulate you on that. So thank you, Ana. And now I would like now to give the floor to Gabriel and Fernando if they want to comment on it. And I would also have a few comments that came from. We also have a few comments that came from YouTube. I don't know if I can already read them. Carola Bertoni from Argentina. She says, "Good morning to everyone." And she asks if the teacher body, the professor body in the virtual campus is permanent, and how is it defined? The faculty is, the teaching staff and the faculty is permanent, and how is it defined? And how does we make the difference between the working conditions and the academic conditions in the campus? And what is the point of that? Are you trying to formalize the OCDS? And Alessandro Ferrari, I believe that it has also from Argentina. I've personally taken part in several courses and capacity building training, but I have a degree in informatics. But I've also was able to collaborate in the assistential aspect in our teamwork. And he agrees with Carlotta Bertoni that we have to prioritize the unrest of our users in the virtual campus. I leave these provocations for our two watchers here, and Gabriel has already raised his hand. Gabriel, the floor is yours. In respect to what Ana Maria has asked, yes, we can, through the studies and analysis of the basis, we're able to understand since when we have these entries in this course, but it's also important for us to understand that this is an analysis that's very preliminary, very initial. And it shows us that we have an analysis that's only general. And then we have to go and understand each one of those registrations per country. So we understand like who began doing each one of them. So then we can take it and I would hook it with what Desi was talking about. And this implicates another dialogue, on a country per country basis and a professional group per professional group basis as well, in order to identify its behavior in each one of those moments and understand what was being told in the beginning. So we're dealing with what's missing. Nobody has registered in your course. And then, so many people have registered in that course in X country. So why did that happen? Not the importance of the general work connected to the organization of the technicians and the networks in order to have better analysis and understand actually why we're having our best practices and why we have those absences in our courses. So thank you, Gabriel. Now I have Fernando and Isabel Dore. Do you want to comment on it? And then I'll pass the speech, the floor to Isabel. Yeah, if Isabel want to speak first, it's fine. Here you go, Isabel, of course. Please, Isabel. Just to answer the questions that showed up, the general questions, I think Gabriel has mentioned about it. So the virtual campus is a platform. It's an educational platform from the OPAS, the Pan American Organization of Health. And it works in a way to give us the level of the American regions as our CUS countries. In that sense, the developments of the virtual campus have something to do with the techniques and the mandates of UPESI. And those are connected to all those things in terms of health. So the technical areas are carrying out proposals of courses according to the committees in the virtual field, and we are prioritizing the developments, and those developments prioritize each one of those technical areas. So in that sense, it's not that the virtual campus is being carried out in a way. So we have a technical term that we need that in a platform is that we're having a pedagogical team that deals with the general development and improvement of quality of the campus. But it wouldn't be carried out in a certain way through the virtual field if you don't have a technical team to actually sustain the platform, to deal with the platform in general. It would be impossible. And that would be the comment I would like to make about it. So that is the point. The campus is not a university. The campus is focused on permanent education. It focused on the continuous education. And the proposals that come up from the needs of improving the practice in those services. A small comment regarding the courses about palliative care and other type of healthcare. I think it's a very interesting part to analyze, because the scenes that we're proposing recently in the areas of chronic diseases, non-transmissible chronic diseases, we have developed these areas through primary care, especially focused on these aspects of primary care that are very important to us regarding these diseases. And of course, we need to identify more terms with our discussion of the project in order to develop other teams that are relevant to this as well. And we need to understand how does the consolidation of those focuses and courses have happened. And it's also one of the topics that we have right now, is trying to understand the fact that we have an offer that's more precise, that's more directed to the profiles that we have detected that are mostly focused at that. But they are also maybe focused on those countries, and that the countries may identify that these are the key profiles inside those professional profiles that we have, and we want to reach all of them. And that's why in this first moment, we're here to identify those profiles, and we intend to carry that out, and we want those profiles to be different, but of course, they are part of this technician universe of those areas. So Fernando now. And I would just like to point out that, the database that we're working on, according to my experiences of working like several different databases and several types of databases, it's a really good database. And it's one that would allow us to extract a lot of analysis from it. It's really, really well structured, and it's a database that will allow us to do a lot with it. I would just like to highlight that, because usually the process is much, much more complex than it's much more complex than it seems to be. Thank you very much, Fernando. So for now, we do not have anyone asking to speak. I would like to say that there is an important matter in this issue here that's regarding the questions. And we have a very subjective interpretation of things here. But there is a perception that the virtual campus is maybe converted into a more preliminary perception that the virtual campus becomes a strategic space for the access of knowledge, for the technical healthcare workers, especially during epidemic episodes. That happened during the pandemics, and that happened during the post-pandemic moment as well, with an increased access to courses maybe focused on prevention and care of regarding the dengue fever, especially right now. I don't know if maybe Gabriel would like to talk about that. Your sound has just cut in the end, Carlos. We couldn't hear the end of your speech.
Precisa abrir seu microfone,
You need to
Carlos.
open your mic, Carlos. You're on mute.
Desculpa.
I'm so sorry.
Perdão. Eu estava comentando da diferença que a gente percebe já entre período pré-pandêmico.
So we notice what is the difference between the pandemic period, during the pandemic, pre-pandemic and post-pandemic period as well, and how we're dealing with that, and how we have a perception that the virtual campus is actually converted into a strategic space by dealing with this qualification, emergency qualifications. And in this moment where dengue is a very serious problem for us, especially in the south region of the American continent, and how that shows up. I believe, of course, this is preliminary data, but it gives us an indication of the values of the virtual campus for the update of these healthcare workers. Just a comment here. First, during the moment of the post-pandemic, the campus would show that the need for a healthcare worker, they have identified it a place where they can find answers for their current practice and their daily practice. So in that sense, the guidance of the courses, and they were a tool, for example, in topics like the dengue fever and COVID as well. They became a point where they could look for answers for something that was a problem for them. And of course, finding out on a country per country basis what is more required, and a posterior analysis allowed us to reach places and people that before we didn't have touch with, we were not in touch with. So that's great, Gabriel. At the moment, we do not have, right now, we don't have anyone registered here, but I would like to, ask a question, but that's a bit provoking with our colleagues from the virtual campus, especially about the question that was asked about the faculty of the virtual campus, if it's stable or if it's temporary. But I think Isabel has mentioned a little bit about it already. But I would like to ask that provocation about prioritizing the unrest of the users, the concerns of the user. Are there spaces where the users can make requests inside the virtual campus? Is there any kind of space in the virtual campus for user requests so that they can manifest their demands? I think we carried out a lot of surveys with our users, and people would, talk to us directly sometimes in the virtual campus. And we have a spaces for that, so we can generate demands and consultations. And this will be about what is about it, like what are the concerns about it. There are dangers to it, of course. We would like to, on our part, to carry out everything that we understand as moments from it. We carry out surveys there so we can understand the beginning and the end of that, so that everything can happen according to the satisfaction. So we have a survey in the beginning and we have a survey in the end to monitor their satisfaction and their interest in a certain course. And on the other hand, maybe the courses need to be renewed, and that would be something like that. We continue having that. So yeah, I want to still be interesting for us. I think there's something that's important here for us, and there's something that's important for our communication here. But if they exploded into the virtual field, for example, the virtual campus, there is a diversity of teams that is very important to us. And I believe that happens in the first moment, since we have these open courses. We have about 300 open courses right now, and that's an important number that really covers lots of our necessities. And it deals with the whole impact of the offer that we have here that's connected to other actions of recovery. Because it deals with the interests that we have for those things and how they will develop their careers, and also the interests of these people that need to be in consonance with all those things and the priorities in the area, especially of their countries, and the health policies of their countries. So we need to deal with those health policies of their countries and be in consonance with the courses. So the offer of courses deals with individuals, but when they go there to this capacity building training courses, when they are in a context where they require something that's missing, so it's something that's done for the collective good, where it's helping the whole community and helping the whole health team. So when one carries out this type of capacity building courses, it's not only their type of articulations and things related to that, they also have actions of cooperation for that. And I also think we need to improve the analysis on a country per country basis. And some of these courses will probably have a higher quantity of those users because there are other actions in that country that are keeping track of that interest. So with that, I understand there are several factors related to that. So we're really, really, really paying attention to those interests because we want to increase the number of users. We want that this growth is actually translated into an improvement of the region in general. So thank you very much, Isabel. That's perfect. We could be here talking for hours, so we're getting to the end of our webinar. But in general, I would like to remind all of you that this is the first of 3 of the cycle. And we're looking to understand what are the profile of the technicians that start the virtual campus. And I'm talking about, we can think about like lots of methodological challenges that we've had. And for example, the acronyms that we have, sometimes a user gets registered with an acronym, and any one of us would be able to tell us what is an ACS, a community health agent. ACS would be Agente Comunitário de Saúde in Portuguese. But this becomes a methodological challenge in the end because we need to share an understanding with acronyms here, and understanding that this understanding between these technicians in healthcare and also the officers for the Pan-American Organization of Health in each one of the countries, they understand that this is fundamental so that we can validate that data and the results of that survey. So we should have another webinar in the month of June to share our results and new moments here, to get deeper into this analysis so we can look for more answers regarding that profile. And also we need to understand what are the gaps, what are the possibilities that we have in order to offer more courses for our healthcare technicians. We understand that this dimension of the problems of technical healthcare workers' occupation, it also rises to the surface when we deal in this type of investigations. And even though we were mostly focused on, let's say, the perception of the profile and the trajectories, we still have that type of issue. I don't know if anyone else wants to make any kind of final considerations for this moment, but maybe we're at the time to finish our webinar. I would like to thank everyone who has participated here with us of this first webinar, especially our friends from Human Resources from OPAS, and our friends from the virtual campus, and also our friends that work in research with us. It was really good to have been here with all of you in this first webinar. So they can keep following us in the next webinars and participating as well. And we'd like to thank Gisele Almeida from Human Resources, Ana Paula Cavalcante from the Human Resources, Mariana, a friend who has almost been with us here in our research. It's very good to be with you here in this moment. I would also like to leave you all an invitation so you can be with us. And I would also like to talk to Isabel, Monica, that you was here in participating in this webinar. Décio as well, who was here giving us really good observations. And we also hope that the observatory, also from UERJ, and also the technical healthcare workers, they are partners. Fernando, Gabriel, all of you, thank you once again, Ana Maria. And we'd like to thank everyone who has been here with us and who are here with us in this morning and afternoon. Thank you very much, and I'll see you in the next webinar.